We're going to have a quick look at cardiac tissue at the cellular level. This will explain what is a contraction, and it actually shows us what we're looking at when we look at EKGs, those squiggly lines. If we start over here at the left, we have a red cell. It's a cardiac cell. It's in a resting state. It is not contracted. It has a bunch of K on the inside. K equals potassium. So in the resting state, the potassium is on the inside. Na is on the outside. Na equals sodium, part of salt. In the resting state, the potassium's on the inside of the cell. The sodium is on the outside. At some point, either because it is hit with electricity or because it leaks potassium, the potassium is going to move out. And as the potassium begins to move out, at some point there will be a landslide of sodium moving in. This movement of these two groups is what causes the contraction. So in its contracted state, you have the sodium on the inside and the potassium on the outside. Now before the muscle can contract again, and we want the heart to contract about once every second, before that fiber can contract again, the sodium is going to have to move out, and the potassium will have to move back in. Once that happens, we're back in the resting state again, and we can do another contraction. And that is the down and dirty, simple explanation of what makes a muscle contract and what the squiggly lines are actually recording. This is what, in an EKG, when you have the P, QRS, and the T wave, what we're actually recording is the movement of these ions in and out of cardiac cells. What we hope is that the contraction is going to move blood. The EKG is not actually measuring blood flow, but we're assuming that when the muscle contracts, blood will be squeezed forward.